Hello, my name is Daniel. My topic is on universal health care. Would it work for the US? Did some research on this topic, came across a podcast from Wharton University of Pennsylvania. The podcast was about 25 minutes long. There was two gentlemen discussing this topic. Mark Pauly, Wharton Professor of Care Management and Professor of Business of Health. Also, Robert Field, Professor of Law and Professor of Health Management and Policy at Drexel University, as well as a lecturer in the Wharton's Health Care Management Department. Mark Pauly and Robert Field discussed mostly cons over pros on this topic, which I found very interesting. They stated that Vermont Senator Bernie Sanders, candidate of 2020 presidential election, has a plan for universal health care. His plan is by having the federal government pay the universal health care for every American. How is he planning on doing this and funding this? Well, Sanders' suggestions for funding universal health care is by raising taxes. Pauly noted that single-payer plan will mean an enormous increase in the tax burden. A single-payer system will be disruptive to the private health insurance industry, losing thousands of jobs. Pauly noted that private insurance companies has been one of the country's most important job programs over the last 30 years. The U.S. healthcare and related industries had 22 million jobs as of 2016 and rising, according to a study. Robert Field examined the costs of universal health care in the US, and he noted that according to a George Mason University study, the plan will cost $32.6 trillion over the next 10 years. The biggest potential benefit with this universal health plan will be no bills. Every American would receive a bill, and that's a really good benefit. I would like to close by stating that universal health care could work, however, at a high price on taxpayers. On this podcast, there were mostly cons. They really didn't speak much of pros. Thank you for listening.